Very good evening to all of you. Today we are going to do the pathology challenge. Let's begin with the first question. Michaelis Guttman body are seen in A. Xanthoganomatous pyelonephritis, B. Malakoplakia, C. Nail patella syndrome, D. None. The correct answer here is Malakoplakia. This Malakoplakia is a variant of cystitis. It is related to chronic bacterial infection mostly by E. coli or occasionally by Proteus species. It is characterized by unusually appearing macrophage and giant phagosome. It points to a defect in phagocytic or degradative function of macrophage. It is a peculiar pattern of vesical inflammatory reaction characterized microscopically by soft, yellow, slightly raised mucosal plaques 3 to 4 centimeter in diameter. So the correct answer is Craniotoblachia. DIC is seen in DIC, very important topic. DIC is seen in A. Acute promyelocytic leukemia, B. Acute myelomonocytic leukemia, CML, autoimmune hemolytic anemia. It is acute promyelocytic leukemia, that is AML M3. Liquefact necrosis is seen in A. Heart, brain, lungs, spleen. It is seen in the brain. Go to the description. There a link is there. Just click the link in the description and join the WhatsApp group. There you will get the details for the 3-day Neet PG ultimate revision breakthrough blueprint covering all the 19 subjects in the most holistic way manner so that you crack the Neet PG in with flying colors. Flare in triple response is mediated by A. Axon reflex, B. arteriolar dilatation, C. Histamine release, D. Local hormone. It is axon reflex. Cystic medial necrosis is seen in A. Marfan syndrome, B. Friedreich's ataxia pattern, C. Down syndrome, D. Kawasaki disease. It is Marfan syndrome. The cystic medial necrosis is a disorder of large arteries characterized by accumulation of basophilic ground substance in the media and cyst-like lesion. It is known to occur in certain connective tissue diseases such as Marfan syndrome, Ehlers-Danlos syndrome, and anuloaortic ectasia. Causes of constrictive pericarditis are A, TB, SLE, brucellosis, both A and B. It is both A and B, so D. So causes of constrictive pericarditis are idiopathic, infectious, viral, TB, fungal, parasitic, post-cardiac surgery, post-radiation therapy, connective tissue disorder, uremic, malignant drug-induced sarcoma. In cell death, myelin figures are derived from A, nucleus, B, cell membrane, C, cytoplasm, D, mitochondria. It is cell membrane. Enzyme that protects the brain from free radical injury is A. myeloperoxidase, B. superoxide dismutase, C. MAO dehydroxylase. It is superoxide dismutase. Fat necrosis is common in A. omentum, B. breast, C. rectoperitoneal fat, D. all of the above. It is all of them. In apoptosis, cytochrome C acts through A. APF1, B. BCL2, C. FADD, D. TNF. It is APF1. Which is activated for nuclear fragmentation in apoptosis? A. Caspases, B. APF1, C. Oxygen free radical, D. all. It is B. Caspases. NXLV is a marker of A. apoptosis. Which of the following is marker for gastrointestinal stromal tumor? CD117, CD34, CD23, S100. It is CD117. Multiple epidermoid cysts are seen in A. Turcot syndrome, Gardner syndrome, and familial polyposis. It is seen in Gardner syndrome. The features of Crohn disease are all except lymphoid hyperplasia. Female is affected, male is not. Disease is autosomal dominant. What is the chance in children? 50% affected, 25% affected. C. 75% affected. It is 50% affected. The inheritance pattern of familial retinoblastoma is autosomal recessive, autosomal dominant, X-linked recessive. It is autosomal dominant. Male-to-male transmission is seen in A. autosomal dominant disease, autosomal recessive, X-linked dominant mitochondrial disease. Autosomal dominant. which is not a feature of Down syndrome, clinically pigmented birth mark, hypotonia, respiratory tract infection, pigmented birth. Lines of Jahn occur in coralline thrombus. Anemia of reticulocytosis is seen in hemolysis, iron deficiency anemia, vitamin B12 deficiency, aplastic anemia is seen in hemolysis. Maximum spirocyte is seen in autoimmune hemolytic anemia, vitamin B12 deficiency, aplastic anemia, none. It is seen in autoimmune hemolytic anemia. The anemia associated leukemia is myelocytic anemia. Chemotaxis is mediated by A. Histamine, B. Leukotriene, B4, C5A, leukotriene C4, C3A, bradykinin. It is leukotriene B4 and C5A. Hyperimmune IgE syndrome is also called as A. Job syndrome, B. Scott Alger syndrome, celiac has. See, this Job syndrome is also called hyper IgE syndrome. Hyperimmunoglobulin syndrome is autosomal dominant disorder due to mutation in signal transducer and activation of transcription 3, that is STAT3. There is a defect in phagocytosis. IgE levels are elevated rather than immunoglobulins are normal. Job syndrome.